Well, over the months, we've been showing you so many people who have risen to the occasion during this pandemic, especially our healthcare workers.
And just before she left New York, I spoke with Fowler. She is a nurse practitioner from Union, and she volunteered to help at Mount Sinai Hospital, one of the worst hit with COVID-19.
You know, I think that all of us just feel that longing to help, and the numbers were down at my office at primary care. And so I just felt like there was a need, and I was there. I think that's what most of us felt, you know, that there was so much of a need in New York City, and we have the skills to do it. So we went to try to help so that we can give some relief to the workers that are there and to the city itself. So, and they've been so supportive of us. They really have.
Absolutely. What do you think you will remember most about this experience?
I think it's just so humbling because, you know, as a healthcare worker, I really don't feel like I deserve everything that people say and do and stuff. You know, it's a God-given talent to be able to take care of patients, you know, and I feel like that's what I did, was use that, because that's what I'm called to do.
And when it comes to you leaving, you know, I mean, I'm sure as much as you've had that fantastic experience of the man who survived, right? The 9/11 survivor, and so many others. I've seen you post the recovery numbers, because there have been so many recoveries, which is so encouraging. But you also probably had to go through some really sad stuff too.
Yes, absolutely. You know, some parts of the city were hit more than others. One of the girls that is here working with me now was in Harlem, working in the emergency department, and she just tells stories of how, you know, they were just so many. I mean, people were staying at home because they were told to come in the last minute with symptoms, and they died. You know, so it was just trucks and trucks full of young, old, it didn't matter the age.
Wow.
So yeah, we actually had some pretty good numbers. Most of the patients that we took care of were able to recover. I think we took care of about 200, maybe close to 250 patients, and in a 4-week, 5-week span, and we had 4 deaths. And that's pretty good. I mean, you know, because their comorbidities, they were older people. Their comorbidities were there. So I think we did really well. The company that I work for, AMI, they actually are looking at going to Ethiopia and some of those other places, West Africa, because, you know, there's some of the places that are going to be hit or are being hit now. So they're going out to help those places.
On the lighter side of things, I'm going to put up the post that you shared. I accidentally put it up earlier of the trick you learned. the barrel of monkeys trick. You have to talk about this. This is hilarious because so many people are wearing masks. We hope people, do you want people to wear masks? Do you think people should be wearing masks?
Absolutely.
All right. So if you wear a mask and you get tired of it hurting your ears, what's the trick?
Yeah, the little monkey. That is so cute. So one of the women at work, her husband actually sent her a barrel of monkeys. And so she gave one to me, and I said, I have got to post that, because all of my friends that are nurses, you know, I think who doesn't have that at home when they have little kids, you know?
Yeah.
And so I think it's a great thing just to protect your ears, because it'll make you sore after a while, no doubt about it.
Absolutely. And hopefully folks are taking the health professionals' advice on the mask. What is your concern now as you head home? When are you going to get home, do you think? You're from Union.
Yes, I am. I'll be home tomorrow, actually. Yeah,
so great.
Tomorrow. Yeah.
Are you so excited?
I am excited. I'm very excited.
Do you have to do any self-isolating and stuff like that when you get back?
I am. It's not really required for healthcare workers because the need is so high there, but I am self-isolating for a while, and I'll be doing some telemedicine from home. But my concern is, you know, we haven't seen as much in the county, and that people won't wear masks and stuff. And I mean, you know, everybody's so excited about everything opening up, and I get that. I mean, like, I'm in New York City with all this shopping that's not opened.
Yeah.
You know, so I get it. I understand. I know we all need haircuts and hair done and nails and stuff, and we just have to be cautious. This isn't the same as it was before, and I don't think healthcare will remain the same as it's been before.
And what do you mean by that? Changes. Tell me what your thought is on the changes.
I think that people will be more cautious. I think admissions will be different for us. I'm not sure exactly how, but I think there's a lot more research that's going into this. I just think it will be. On one note, you feel like, you know, people will be scared more when they have the least little thing, like they have a cough, and they'll be more scared that, oh my gosh, what do I have? And on the other aspect, I think that people will want to stay at home more. So we may see more of this telemedicine actually be used to take care of patients than actually in the hospital or in the office.
We appreciate Tina talking with us. And she actually got back home last Saturday, so this is her first full week home. Hope you're having fun quarantining or self-isolating, Tina. You can check out the full interview, by the way. It's on the WSPA Facebook page. If you scroll through the video section, you'll find it.
Hopefully she can get to New York in the future when all those stores are back open and she can do some shopping.
I hope she gets that chance.
I hope all the healthcare workers know how much we appreciate them,
Yes.
though. I mean, just what a moment in their careers.
Yeah, she was our opportunity to kind of salute them all. And she's just one story of the very many out there.
Great interview. Coming up on Carolina's Family at 4, as we head into Memorial Day weekend, race fans have something to look forward to with a patriotic flair. We're going to head live to the Charlotte Motor Speedway next.